Good afternoon, and thank you for joining us today. I'd like to start by welcoming some special guests, Chancellor Don Elliman, Liz Concordia, President and CEO of UC Health, and Rafe Schwartz, Chief Strategy Officer for Colorado Children's Hospital. I'd also like to thank Mark Couch and Shanti Na for all the work they've done in putting together this presentation with me today. I hope your new year's off to a productive and fulfilling start. We are going to cover a lot of ground today, so to help you with that, we provided this QR code, and I'll give you a few minutes to take a look at it. This will allow you to download the presentation, view the slides, and share them with colleagues. By the way, today will be an interactive presentation, so get ready. We gather here today to celebrate our successes, evaluate where we are as a School of Medicine, and to discuss how we can put our dreams into action. And I believe we have big dreams. It's my goal to work with you to ensure that we are top 10 in 10 years. And this happens through teamwork, rigorous analysis of data, innovation, and steadfast commitment to our common goals. So today, we will recognize some of our extraordinary colleagues, look at the missions of our school, assess the challenges that we may face, and outline some of our new priorities and new initiatives. I believe we are off to a strong start. However, the leadership at the School of Medicine in the past has also provided a solid foundation over the past several decades. I want to begin by thanking Dean John Riley for his 9 years of service. His tenure was indeed a transformational period for the school, and his dedication was key to its growth and its ascent to prominence. During Dean Riley's time, our clinical, educational, and research programs all grew. We attracted top talent, and we secured substantial philanthropic support. For example, the school's annual research grant portfolio increased from $359 million to almost $600 million. And now today, we stand at almost $650 million annually. The number of our faculty members rose from just over 3,500 to just over 5,000. And today, we stand at over 5,500 faculty. Our physical therapy program rose to the rank of number 11. Applications to our School of Medicine grew from under 7,000 to well over 10,000 applications each year for 184 spots. In 2017, our School of Medicine clinicians provided care to an incredible 2.7 million patients. In 2024, this was 5.7 million patients. Philanthropic support totaled more than $1.2 billion during Dean Riley's tenure, and the number of endowed chairs increased from 89 to 148. That's one new endowed chair every 2 months. Scott, Allison, and Sarah, and your teams, thank you for your hard work. These successes are the result of a dedicated effort over many, many years. So I'd also like to extend my gratitude to Dean Richard Krugman, who was in this role for 25 years and helped lead the transition of our school to this magnificent campus. I want to thank these leaders for their hard work over the years, their exceptional focus, and their drive to create a campus where we can stand on solid ground as we reach for the stars. These numbers reflect your hard work. So here comes the interactive part. For those in the room, please stand if you received a grant last year. Please stand if you published a paper last year. Did any of you care for a patient? If you did, please stand. What about those of you who taught a student or mentored a colleague, whether in the clinical or even the administrative space? Please stand. That's what this is all about. Please give yourselves a round of applause. That's how we make a difference in the lives of others. This past year, we also celebrated the transition of leadership in 2 essential programs. Dr. Jeff Connors from the Department of Medicine was named the Associate Dean for Graduate Medical Education, and Erica Freitas became the new director of the CU Center for Interprofessional Education and Practice. As head of our GME program, Jeff leads one of the largest physician training programs in the country. Jeff, thank you for taking on this monumental task. And also thank you to our interns, our residents, and fellows for their absolutely tireless work. I want to extend my highest regards also to Dr. Carol Rumack, Distinguished Professor of Radiology, who served in this role since 1992. At the Center for Interprofessional Education, Dr. Freitas will continue to advance this program, which really enhances and encourages a shift in our culture from a siloed healthcare approach that is fragmented to one that is cohesive and collaborative and really enhances the care we can provide to our patients. She succeeds Dr. Susan Brandenburg, who led the program since 2016. Many thanks to Dr. Brandenburg for her leadership. Our clinical leadership team also welcomed 2 new leaders. Dr. Shikha Sundaram was named Associate Dean for Child Health, and Mark Young was named Associate Dean for Community Practice. They are clearly already making a difference, and I look forward to see what these extraordinary leaders can do in the years to come. Also last year, 4 of our colleagues were named Distinguished Professors. This is the University of Colorado's highest honor. Since the creation of the Distinguished Professor Program in 1977, only 156 CU faculty members have earned this distinction. Of note, Dr. Krebs, Leung, and Stenmark are all members of our Department of Pediatrics. Dr. Krebs and Stenmark practice at Children's Hospital, which is routinely named one of the country's best pediatric hospitals. And Dr. Leung is at National Jewish, a very important partner for us. A little bit about their work. Dr. Krebs has fundamentally changed the understanding of pediatric nutrition and fetal infant growth nationally and globally. Dr. Stenmark is an expert in pulmonary vascular hypertension and pediatric critical care medicine. His work has garnered an almost unbelievable $103 million in competitive funding since 1985. Dr. Leung also incredibly has had 30 federally funded grants and published nearly 1,000 manuscripts. Finally, Dr. Norris's pioneering work has significantly advanced the understanding of how lifestyle, genetics, and environmental factors affect the development and treatment of diabetes. Well deserved, and thank you. Let's also give them a round of applause. Many of our other faculty members received important honors this year as well, including Dr. Tracy Bale, Professor of Psychiatry, who was elected to the prestigious National Academy of Medicine. She studies the role of stress dysregulation in neurodevelopmental and neuropsychiatric diseases. Dr. Leigh Cervantes, Professor of Medicine and Director of Immigrant Health, received the Bernard Lown Award for Social Responsibility for her important work advancing health equity and expanding access to care for undocumented immigrants. Dr. Amy Gardner, Professor of Surgery and Associate Dean for Faculty Development, was awarded a Fulbright Scholarship to study leadership development programs at the Royal College of Surgeons in Ireland. These individual accomplishments contribute to an extraordinary culture of achievement, and you are that community, and you have helped make the state of our school strong. Our clinical work is impressive and shows how much our neighbors depend on us. To provide the best possible care, it helps to have strong partners. With Children's Hospital of Colorado, we have one of the best pediatric hospitals in the country. It ranked number 1 in Colorado and is among the top 10 in the country. Similarly, UC Health, University of Colorado Hospital, was again ranked the number 1 hospital in Colorado, a rank that it has held for an incredible 13 years in a row. Another valued partner is Denver Health, which was recognized by the Lown Institute for outstanding social responsibility. The VA, an essential partner for us on campus, certainly provides extraordinary care to our veterans, but also serves as a vital partner in training our future clinicians. And National Jewish Health brings national recognition to us for research and treatment in respiratory, cardiac, immune, and related disorders. I'm proud to say that our school is also home to extraordinary centers of excellence that ensure that we provide nationally recognized care, including the Barbara Davis Center for Diabetes, the University of Colorado Cancer Center, the Gates Institute, the Center for Combat Medicine and Battlefield Research, and the Ludeman Family Center for Women's Health Research, among so many others. The full impact of the quality of our care can be seen in the lives of the faculty and our patients. Take, for example, the care of 4-year-old Christian Helfrich. He was diagnosed with bilateral retinoblastoma during the first few weeks of the COVID pandemic. Last summer, Christian completed successful treatment led by our colleague, Scott Oliver. As you can see here, Christian celebrated with a menagerie of mascots from Colorado's major sports teams. I must say I'm a little jealous. Identifying the disease early was certainly critical to successful care, but it really helped that Children's Hospital of Colorado was one of the few centers in the world where intra-arterial chemotherapy is available for this disease. Another example of how patients inspire our work every day is the case of college football coach Matt Lubick. After a diagnosis of acute myeloid leukemia, Coach Lubick enrolled in a clinical trial led by Dr. Dan Pollier. On the first day of chemotherapy, Coach Lubick walked a marathon, literally a marathon, in the halls of University Hospital. Makes me feel a little guilty that I didn't even exercise today. Here's a clip from a longer report that Fox Sports aired last fall about the care that Coach Lubick received from the CU Cancer Center by our colleagues, Dr. Pollier, Dr. McMahon, and Dr. Gutman.
At 52, Lubick has coached everywhere, from Duke to Arizona State to Oregon. He was working for Kansas last fall when he grew fatigued and feverish and saw a doctor. October 7th, 2023, doctors delivered the news: leukemia.
Patients can get very sick with it very fast. Untreated, it can very often be a lethal disease within a matter of weeks.
October 17, 2023 was Lubick's first day of chemotherapy. Attached to an IV unit, he began to walk. On the hospital's 11th floor, down a 60-meter glass hallway, Lubick kept walking.
It's just me and that pole, you know, going back and forth, back and forth, back and forth. It was over 12 hours. I finished like at 10 p.m.
Lubick covered 26.2 miles, 51,550 steps. On day one of chemo, he walked a marathon.
What an incredible spirit to have that be your response to being diagnosed with an unbelievably devastating disease.
It was immediately clear just how determined of a person Matt is. He was so determined to beat this cancer.
You know, the leukemia, you kind of think about all the things it's taken away from you, but it didn't take that away from me.
Dr. McMahon said that Coach Lubick's determination offered vital inspiration to everyone who took care of him. There are thousands of patient stories like these that we could tell, and we should be proud of all of them. It shows the difference that we can make in the lives of others each day because we are on this campus. We'll post links to these stories and others on our State of the School webpage. Our excellent clinical care, however, is really based on outstanding scientific achievement. and our school excels in research. In 2024, our school's researchers attracted well over $500 million in research funding. At that level, our school already ranks among the top 10% of public medical schools. As a result, last year, U.S. News ranked our school as a top-tier institution for research among the ranks of Yale, the Mayo Clinic, and UCSF. What's incredible is that our research teams continue to attract significant funding. For example, late last year, Dr. Kia Washington and Dr. Christine Wong, both professors of surgery, received up to $46 million in federal funding through the ARPA-H program to study restoring vision through whole eye transplants. Transplanting an eyeball? Imagine that, the opportunity to give sight back. Here's a terrific video by the campus communication team where Dr. Washington and Dr. Wang describe their work.
Currently, there really isn't any medical or surgical treatment for blindness. Some would say this is a moonshot. You know, we are shooting for the moon and hopefully we'll land among the stars. Well, this potentially means that we can help the over 3.5 million people in the United States suffering from total blindness. And the goal is to restore vision with whole eye transplantation. The surgery is pretty much like any other transplant surgery. The eye would be taken from a deceased donor. It would then be transplanted into someone that needs an eye to restore vision. It includes sewing together the blood vessels to restore blood flow, as well as the optic nerve, the nerve that restores vision. The optic nerve is part of the central nervous system, or the brain. And typically the brain doesn't recover from injury very well. So part of the challenge is to get this optic nerve to regrow or regenerate.
In any transplantation, in order for the transplant to be accepted, the patient's immune system needs to be modulated or suppressed. And so if you immunosuppress a patient, then they're going to be more susceptible to other complications. We're studying targeted ways of manipulating the immune system so that they can accept these types of organs without high levels of chronic immunosuppression. And some of the research that's being done may lead to breakthroughs that could benefit all transplant patients.
CU Anschutz is a place of innovation, a place that really supports innovation and new therapies. We are going to really be able to help a lot of people that are suffering throughout this country and the world.
And Dr. Washington and Dr. Wong actually aren't the only ARPA-H grant recipients on our campus. Dr. Matthew Winia and Dr. Eric Campbell are studying through this mechanism ethical issues around providing mRNA in capsule form to treat diabetes and obesity. Dr. Michael Zusik and Karen Payne from orthopedics are studying non-invasive therapies for osteoporosis in partnership with CU Boulder and CSU. We have a strong team on our campus to help get ARPA-H grants and other large grants and get these applications into shape, which can sometimes be a Herculean effort. And I'd like to thank Dr. Laura Boccini and Tom Flagg for their efforts on our behalf in this regard. Such projects like this are really hugely ambitious. And as you heard Dr. Washington describe her work as a moonshot. In fact, though, some of our faculty's research truly is out of this world. Take, for example, the collaboration between Dr. Prem Subramanian from ophthalmology and Dr. Ali Heyman from CU Boulder Aerospace Engineering, along with the crew from SpaceX Polaris Dawn. Working together, our team is exploring the impact of spaceflight on human eyes. This program, I believe, is a model of the collaboration and innovation that typifies this campus. Key features that I think will help our growth in research in coming years. These successful clinical and research accomplishments help support our educational programs. Our trainees are the future stars of medicine and health science. They include clinical students in our medical, physician assistant, physical therapy, and anesthesiology assistant programs, PhD candidates in our scientific programs, and interns, residents, and fellows in our graduate medical education program. Importantly, 42% of our graduates last year chose to practice medicine in Colorado. The rest, however, are making impressive impacts across the country and throughout the world. For our trainees to shine bright, we must do our very best as educators. We teach them the science so that they can make future breakthroughs that improve care. We must model that behavior, for it prepares them for fulfilling and productive careers. In that regard, one of our outstanding faculty members is Dr. Amy McDivitt, Associate Professor of Physical Therapy. At this year's Physical Therapy Convocation ceremony, Dr. McDivitt received the Excellence in Teaching Award for her skill as an educator and for her dedication as a mentor. She is a role model for our school, and we thank her for her leadership. To serve our trainees, we need to constantly invest in new programming and support that programming. Scholarship funding for our medical students has grown significantly since 2016, thanks to our Office of Advancement and to the generosity of our alumni classes. Also, our curriculum for medical students has been redesigned in a way that actually made me want to go back to medical school. Well, maybe not really, but it's exciting. Our teaching program, in fact, is so novel that Dr. Abraham Nussbaum, who is Chief Education Officer at Denver Health, actually wrote a book about it. The book, entitled Progress Notes, 1 Year in the Future of Medicine, describes the work of our Dr. Jennifer Adams, teaching a group of medical students at Denver Health. We are grateful to all of our preceptors, be they at Denver Health, the VA, Children's Hospital, or UC Health, but also in the innumerable private practices throughout our state, both urban and rural. This new curriculum is sure to be a distinguishing feature of our school, and it is prominent as we go through our LCME accreditation visit this spring. I want to offer special thanks to Dr. Shanta Zimmer, Associate Dean for Education, Senior Associate Dean for Education, and the team led by Bonnie Kaplan and Kristen Hayden for their tireless work in this regard. This accreditation has to be a major priority for us this year, so big thanks to everyone who literally contributed thousands of hours of work to get us ready. Not only will this curriculum allow us to prepare new clinicians who are excellent at providing care, but also creates a culture in their minds of lifelong learning. We certainly should be proud and empowered by the comprehensive and bold vision of our new curriculum. The mission of community service is also palpable on this campus. We serve all who need care. In fact, in 2024, we served residents from all 64 counties of our state. We also support 120 community-based programs covering a range of physical and mental health needs across Colorado. Our outreach programs help community clinicians, and we are grateful for the federal support and the efforts of Congressman Jason Crow, for example, that allowed expansion of our rural e-consults program. Since arriving at CU, I have been consistently impressed by the commitment to the community by all of our team members. One outstanding member of that team is Dr. Mark Deutschman. As Associate Dean for Rural Health, Dr. Deutschman literally treks across the state and visits with rural healthcare providers. He's been nothing less than a relentless crusader to support and build our capacity to care for our neighbors across the state, but also to continue this vital program. After nearly 50 years, Mark has announced a phased retirement plan, but fortunately has agreed to stay on part-time to ensure that this essential program continues. Thank you, Mark. Younger members of our school community are also engaging in extraordinary community work. Last month, 2 of our third-year medical students Firdos Abdulkader and Kenzie Harrington, were featured in a newsroom article for their work on community projects promoting skin health. Through several projects, they increased awareness around skin safety and cancer prevention and installed sunscreen dispensers at Colorado state parks. And Firdos and Kenzie did all of this while continuing their studies. I'd say that's the CU type of extraordinary. As we celebrate the impressive accomplishments of our school, we stand ready to address the challenges we will face in the years ahead. Changes to federal policy, even when they may be temporary or quickly rescinded. Thank you. Add uncertainty, nonetheless. We saw this last week, as many of you are aware, with pauses in activity at the NIH and with executive actions that related to programs that promote equity. You should know that we remain steadfast advocates for our people and your work. Medical research and comprehensive care is central to our mission, which is to educate, to innovate, and to improve all human lives. We must also pay attention to our position in the marketplace and the quality of care that we provide so that we continue to be the first choice for people who need care. And we offer the best and most comprehensive patient-centered care that is consistently informed by the latest science, and we should be proud of that. For our clinicians, however, sometimes these advances are increasing the demands on their time. And so we will seek smart solutions. For example, through the use of AI to assist in taking notes during patient encounters to reduce pajama time. And this will just be one of many measures we will take in the coming years to address well-being. To address our challenges, we are setting some new priorities and launching new initiatives. As I stated in my interview to become your dean and when I arrived in July of 2024, we're going to focus our efforts in all ways to make our school top 10 in 10 years. It's a bold goal. In all aspects of our work, though, I want us to be top 10, which should be among the first places recommended for clinical care, for medical education, for health research, and maybe most importantly, one of the best places to work in all of Colorado. We have many of the elements needed now to get there. We just need to channel all of our attention and all of our energy towards those shared goals. Our strategy is to start to engage you in multiple projects that will create a more efficient organization at our school, stronger relationships with our partners, growth opportunities for you and for our school, and recognition that our people will always be our greatest asset. To do this, we will establish some new committees to help us. These committees will have big assignments in big areas. For example, I will charge them with building a collaborative culture, establishing a community strategy for our clinical enterprise, raising the voice of our advanced practice professionals, a very important voice, and adopting data standards so that we can better understand how we do our work. We also need to ensure that we develop growth opportunities for our school by collaborating with the Fitzsimmons innovation teams. To do that, we welcome Kimberly Muller to her new role as Vice Chancellor for Innovation and Biotechnology, and also welcome former Denver Metro Chamber Chief Kelly Brough as the new CEO of the Aurora Fitzsimmons Innovation Community. We will engage with our clinical partners and our philanthropic community to build stronger partnerships for our work. The Anschutz Accelerator Initiative is a major example of how we've done that. We are grateful for the generous support of the Anschutz Foundation for making it possible for our teams to literally advance their scientific innovations into patient care more rapidly. We also want to thank these other foundations for their generous support, including the Gates Frontier Fund, the C family, the Rady family, and also our partnership with UC Health. Earlier this month, we hosted a research retreat with UC Health to prioritize programmatic areas where we collectively believe we can make a difference in patients' lives in the years ahead. At that event, we collectively evaluated our strengths, looked at our opportunities, and chartered a path for deeper discussions. I think we made incredible progress, and I'm excited to work with UC Health to build programs that will make a dramatic impact for our patients and make a big difference for our school. To keep you informed on all of this and our progress, we will be launching a series of town halls. We'll do that early this year to better keep in touch with all of you. I'm looking forward to a great 2025. I hope you are too. I am certain that we are better together. And now I'd like to ask for your help to better understand your priorities and your concerns. Please scan this QR code and fill out the short survey. I want to hear from you. I want to know what you consider our greatest strengths, our biggest challenges, and tell me where you want to be in 10 years. Thank you all for your attendance and your attention. Have a great rest of your afternoon.